Well, hello and welcome to another Thursday Live here at the Association of PEMF Professionals. I'm Dr. Jerry Dreessen, your host, and today we are going to be talking about edema, lymphedema, and wound care with using PEMF. And again, let me just jump through another spot. There we go. So if you are watching this live, again, feel free to comment below. If you're watching the recording of this, thanks for watching. And again, feel free to jump in and ask questions or add comments below. And we'll be more than happy to answer anything that you have going on. So with that, let's get rolling. So AOPP, we like to put together a weekly live and talk about certain topics, those of you that are watching for the first time here. And today's topic is about using our PEMF units, and it is designed to help out post-injury swelling, venous swelling in the legs, lymphedema after surgery, and then chronic wounds. And again, making sure that you are working hand in hand with a healthcare professional. If that's you, you're good to go. If you're not sure if you should be using PEMF on somebody with any of these things, ask them if they've got a treating physician that you can work with. And then, of course, you can always ask us, because we've got a couple of doctors here that are members, also, some of the founders too. So we're here to help you with those questions. So now let's understand what swelling is. And so there's three types. There's a post-injury or after surgery. So things can be puffy and warm and tender, but oftentimes it's because you slice through this network of tubing, and then that tubing has been cut, and then it starts to continue to drain in the area. So you get all this swelling and edema. And then what happens over time is that blood system will begin to reconnect, and then the flow goes again. So that's the cool thing about the body. But while there's swelling in there, it stretches all the fibers. The pain fibers are more sensitive. I often talk about cutting the head off the dragon where it grows 7 more heads. That's how a pain fiber is. A pain fiber is a type C fiber that has nothing on the end of it, and it's just there to register pain. And when you injure an area or you cut through one of those, it'll splay out, and now you've got multiple tips on that pain fiber. So whereas before that would cause pain, now you've got this, and this can cause pain, but you can have that same area touch, and now you've got literally 5 times the amount of pain that you would have from the same amount of pressure. And that's there to help tell your body to be careful. So it's a warning system. It's like, be careful, don't touch this, let this heal. And then as it heals, again, those pain fibers, they'll break loose. They'll come back down and be more of a single pain fiber, and then you won't have pain anymore. So puffy, warm, and tender. Venous swelling. So again, gravity, it pushes things out. And at the end of the day, you don't have, especially if it's a lower extremity, it's going to be more puffier, or just even your feet can be puffy from an upper bleed or, swelling, because gravity will pull that all down too. So at the end of the day, remember just to elevate and keep your feet above your waist, that kind of a thing. Sitting in a zero gravity chair works really well too, because it balances the body and helps with any kind of swelling too. I just wanted to do a quick shout out to Barbara. Hi, Barbara. Welcome to the live. Thanks for watching. And then, of course, the lymphedema. So we have what's called interstitial fluid. So if I were to just cut my arm and open it up, there's all this space that's in there. You got your blood system, what's all enclosed. You've got your muscle system that's all enclosed. Well, we have this fluid called lymph, and it's interstitial, and it's moving around. And we have lymph nodes, which are like in our neck, underneath our chin. We have them under our armpits. We have them in our groin. That's where these clusters of lymph nodes are, and they're designed to absorb and attack. They're full of white blood cells, and oftentimes you'll get like growing up, you'll have a swollen lymph node in your neck. It could be from a toothache or some kind of wound. And so what happens is that lymph will absorb the bacteria or virus and pull it in, or like when you have a cold, you can get a swelling. But anyways, this lymph system is designed to pull in and attack. Sometimes if there's a giant war going on with the good guys and the bad guys, after it's all over with, that lymph node can be rendered useless, and it just becomes this little hard bead that's in there. And some of you may have that. You may have kids with that too. But that whole system is moving around. And so you can have, with an injury or surgery, you can have that swelling pushed into the lymph system, and it's got to work on trying to get rid of that too. So you can have lymph flow that needs to be addressed. So those are the three common types. We've got injury, you've got blood, and you've got the lymph. So if you can think of those three issues as your standard, there's other ones too, but those are kind of the main ones. So again, safety first. If there's sudden calf pain or heat or one-sided swelling, again, is it a blood clot? Those are the things we have to be careful of. It's like, my leg's hurting me. I got this spot right here. It's really tender, kind of swollen. Okay, that's where we as doctors and you as practitioners can start asking questions. The who, what, when, where, why, and how. When did this happen? How long has it been there? Has it happened before? All of those things that we go over in our questionnaire that we give you, those of you that are members, where you can ask those questions. And again, this is almost basic CPR, but is there shortness of breath? Is there a fever? Are there red streaks, like a blood poisoning? Is there any active bleeding? So if all of those are no, then you're okay to move on to the next step. And again, as always, be careful or be cautious. Any kind of pacemakers or electronic implants, pregnancy, always keep wounds clean and follow wound plans. So we're kind of on the side of pain and swelling if it's due to like a spider bite, for example. Those are the things to. In fact, I just had a woman come in yesterday. She goes, "Look at the top of my head." And why? Because it's all swollen. And I look and I shine my light on it, and there's this nice red mountain with this almost like a Tic Tac size bead of pus on top of it. It's like, whoa, you just got bit by something. She goes, "Yeah, we got a bunch of spiders in our house." And so would I put PEMF on that? I would probably not for that instance. It's like, we need to get that. It's already pushing the poison out. That's why it's white on top. But, if you can get that to pop and then let that ooze and then put some Neosporin on it or something to get the system to heal, then you can start doing PEMF to help speed that up. But what you don't want to do is increase blood flow around an area that's got toxins in it, because it may start absorbing that and spread it further into the system, which is what you have to be careful of. So be careful, be cautious. What is that? The ABCs: always be cautious, always be careful. So then some practical how-tos. So the three common use cases, we've got a fresh sprain strain. So again, things that are fresh and new, like a sprain strain, PEMF works great on. I've taken it to, worked with power lifters. I've got sports, football, sprained ankles. I've seen the swelling go down in a matter of minutes using PEMF on certain areas of the body. It's great for that. And it's like, well, how often, how frequent? And again, we always talk about start slow, start small. The person may have, again, if you're not doing the pre-interview, if they're not, on any kind of medications that you need to be aware of, or if there's any surgeries in the area, all of those things. If everything checks out and they're all okay, and you got the green light from our checklist that we have, when you start using PEMF, that first session needs to be low and slow, and then see how they do with that. But we like, to have things like 8 to 12 minutes, 10 to 15 minutes. If you have 5-minute increments, we've got adding rest and ice and elevation. So, ricer, rest, elevation, compression, elevation, and then any kind of uh, soft tissue, compression around the area. Those of you that have compression units, those are all good as long as you're not blocking the circulation, of course. But they may need to have a brace too. So some people, when you're out in the country, they don't have time to go see a doctor. It's like, take those 2 boards and rope it around my ankles so I can start walking, And so it just depends on the person you're working with too. And you guys know the personalities of the people that you work with. But I would recommend that you do PEMF, 10 to 15 minutes at a time, and do it twice a day, and lots of fluid and lots of water. And then as far as the lymphedema, again, treat near the body first, and then the limb, and then so you're kind of working that system and you're getting that lymph flow. Massage therapists, they like to work like out at the feet, and then they'll work their way towards the main body. And PEMF is kind of like that too, where you're working on the area where there's the most swelling and tenderness, and then you just kind of channel it up the system and let that interstitial fluid kind of move its way up and get reabsorbed into the system. Slow healing wounds, again, treat around the wound, around it, not on it. So you've got, I guess you'd say, mitochondria stimulation, you've got blood flow stimulation, but again, think about the wound. Is it a clean wound? Is it a post-surgical wound? Is there any tenderness, swelling, or oozing where the site is from a an infection or something like that? But again, if you check all the boxes, everything's good to go, then yeah, just put it on there. Let PEMF do its magic, which is what I like. What I like about PEMF is it's so pro healing, right? And also it's not just the skin, it goes into the muscle, it goes into the bone, it goes through the body, depending on how powerful your machine is. So, you could put it on a shoulder and it's going from the front to the back, and it goes all the way through that system. And then as far as dosing and tracking progress, again, start low, go slow, and observe. Have a piece of paper or a phone, record what you're doing. That way you can recall. I like, with a patient that has a wound, to record it. Let's take a picture of it. You have a picture of it. Let's, because oftentimes our memory, especially if you're working with a lot of clients, it's like, oh my gosh, which one of, was that, whose leg was that that's in my memory, kind of a thing. But if you've got it all documented and you can look at that and you can even show them, because they're like, I don't know if this is working. Well, according to this picture, it's 50% better. Oh, wow, I forgot that it looked like that. I forgot that it was purple, now it turned yellow and it's, reabsorbing and stuff. So kids, less, and adults, again, it depends on who they are, what they've got, what they're, if they're a power lifter versus a bedridden or sits in a chair only elderly person, you're going to, treat accordingly. And again, anytime I work on an elderly patient, I know that they've got a pharmacy in their purse. Literally, it's like they're on tons of medication. And we all know that maybe 90% of that they don't need to take. But somebody said it would just be a good idea to take it, or it's being used to overcome the adverse reactions to one of the other medications that they're on. And oftentimes with PEMF and reducing swelling and stuff, you'll know that they're able to get off some of these medications because their body starts to work better. So the tracking the results, those of you that have the kit that we talk about, in there is a cloth tape used to measure around areas. And if it's like halfway up the leg, well, then from the outside ankle, measure up. So that way you know how high up to go and then go around. And then that's your circumference measurement. So that way you're always consistent, versus like, oh man, I was somewhere on the calf when I measured that, or somewhere on the arm. So have a landmark, measure from that, and then do your measurement. So it's a 2-step process. And then have them rate their pain, and on a 0 to 10 scale. 0 is no pain, 10 is the worst pain they've ever felt. In our clinic, we have a little set of faces. So the kids, it's like, which one of these faces is you? So they can use that, and it works the same way. There's a line with a 0 and a 10, and they cross a line over where they feel on their pain. All of those have been shown to be very accurate versus just having asking them their number. So you can use a visual scale on that too. And then when you are working with them, every time they come in, take a photo of it, take a measurement of it, put it down on the chart that you've got for them so that you can chart that progress and that they can see it too. As a chiropractor, our auto accident patients, every 30 days, we do a reevaluation and we're checking range of motion. So like in their neck, if they had whiplash, they may have only gone 15 degrees forward. And then in 30 days, now they're 25. Well, if you just visualize it, you may not catch that. Or the patient at any time, they're going, I'm not sure I'm getting any better. It's like, wait, okay, let's measure it. And we'll measure everything. It's like, wow, you've got an extra 10 degrees, extension than what you had last time. And then when they see those numbers, they go, oh yeah, wow, great. I didn't realize that. I didn't notice it. And oftentimes as our pain disappears, we don't feel the pain that we felt while we're moving the joint. And so again, tracking it as if you didn't pick up on that theme already. Write it down, track it. It's for you. It's also for the people that you're working with. And then also look for less swelling, easier movement. So, track the range of motion. Those are all of the things. And if you can find a way to do that with the animals too, it's the same type of thing. Is it less red? Are they moving it better? Can you get in there and touch it without them reacting? So all of that stuff. And the more specific you are on your chart note, which we use a SOAP note, SOAP, subjective, objective, action, and then prognosis. So action is what you do, but subjective is what they say, objective is what you measure, action is what you've done, what you did that day, and then prognosis is how they are, how you think they're going to be, or, when they should come in next and what they should get next. So that's the SOAP chart or SOAP note, which is the basics. And then it's a short one today, but I mean, that's the basics there, because you really need to make sure that you can use PEMF on an area that's swollen. And I would say 90% of the time you can. There are, that one or two people that come in or see you and you looking at it, you go, I don't know if I should do this or not. When in doubt, say, you know what, you should go see a wound specialist. I'm not sure I can do PEMF around that arrow that's lodged into your thigh, those kinds of things. So use common sense. I'm sure you do, but I thought I'd put a little levity into that. But I do want to thank everybody for showing up. And Janet, hey, South Carolina, welcome. And thanks for watching. And again, those of you that are watching or watching the replay of this, and all of these do show up as a replay. If you are interested in knowing more about us, hop on over to our website, PEMFprofessionals.com. We do certification programs for humans, animals, large animals, small animals, red light therapy. And with that, you have an international certification because we're in 17 countries, not just the United States. We have a really large group. And if you have any questions or tips, again, send them out to us. And the things that you can do, again, we are growing. In fact, our next PEMF convention, which will be virtual, PEMF Con, is coming up in November. And we'll have more about that as it happens. You'll be able to see that in our feeds. We'll be having some social media that's there. But you can like and share today's broadcast, but also go into these other media that we share on Instagram and Facebook, and like and share those too. And we've got some really good speakers that we've got for our PEMFCon, and we'll know as we begin to button them up, we'll be announcing those as well. So looking forward to that. And with that, again, thank you so much for being here today, hanging out with me for a few minutes and learning more about PEMF and how to grow your business and maybe some golden nuggets from it. All right. Thanks. Take care, and we'll see you next week.